Good afternoon, everyone, and thank you for joining us on this Men's Health webinar, Challenges and Opportunities. June is recognized as Men's Health Month, and WorkWell NYC joins with every man and those who support their spouses, partners, sons, grandfathers, uncles, nephews, cousins, friends, co-workers, and each and every one of you on this webinar, where we're promoting information on awareness and prevention to living healthier and happier lives. We truly understand the importance of men's health, and we convene to recognize its significance in our workplaces, and for each employee to take the information and empower others beyond. We here at WorkWell NYC desire to continue to heighten the awareness of preventable health problems, and we encourage early detection and treatment of disease among men and boys. So if you're a healthcare provider, a policymaker, a public health worker, each and every one of us are afforded the opportunity to encourage the men in our lives and each other to seek regular medical advice and early treatment for disease and injury. So with that said, a little bit about WorkWell NYC. WorkWell NYC is the city's worksite wellness program. Our mission is to create inclusive spaces that reflect the rich diversity of New York City employees, with the goal of keeping healthy people healthy, reducing risk, and helping individuals manage chronic conditions for optimal health and well-being. WorkWell NYC has 4 distinct areas of focus that address health and wellness for employees at the worksite. The first one is Move More. Move More provides resources and opportunities to help employees get moving at every level of fitness, no matter where you're at. And that can be done through our walking challenges and our upcoming 5K. Make sure that you watch out for information for that. That's going to kick off on June 22nd. Our second area of focus is Eat Well, where we provide fun and practical tools and activities and tips that actually takes the mystery out of healthful eating, such as our 5 a Day Your Way challenge, Weight Watchers, cooking demonstrations, and many nutritional workshops. Our third focus is Taking Action. And that helps employees take control of their health by connecting them with the information they need to get healthy and stay healthy. And that's through the Quit Smoking program, Escape, getting your flu shot, and our diabetes and hypertension programs. And our last bucket, Be Well. That provides support and resources and referrals to help employees be resilient and manage the stresses of everyday life. And that can be done through meditation, gratitude challenges that we have, and particularly during this time, offering a very safe place to just talk. So we need to hear from you. We need you to join the conversation. It's so important that your voice is heard regarding our programming and events. You can join the conversation via Instagram at WorkWell NYC, or join our mailing list to receive additional information regarding WorkWell NYC, on.nyc.gov/mailing list. At this time, I'm going to hand over the remainder of the webinar to our moderator, Daniel Calder, who is our citywide wellness coordinator at WorkWell NYC.
Hi, everyone. This is Daniel Calder. Thank you, Catherine, for introducing me, and thank you, everyone, for joining today. Let me start my video. There we go. So once again, my name is Daniel Calder, and as the host, the moderator today, I'm just going to guide the conversation. Throughout the webinar, you'll see a couple of polls pop up, and I'll prompt you to answer those polls when we get to it. And then we're also going to have a live Q&A at the end. So you see in the chat box, throughout the presentation, whatever questions you have, put it in that chat box. And then, later at the end, when we have a live Q&A, I'll ask Dr. Torien Easterling those questions. Before I pass it over, I would just like to go over today's agenda. We have three simple components of today's webinar. We want to explore common health issues facing men today. We want to review behaviors that drive optimal health, and we want to develop a personal action plan for daily health habits. Next, we have actually our first poll. So the poll will be coming up right now. If you can answer that, please. And here we go. How do you describe yourself? So please place the answer that pertains to you and submit that. Okay, it looks like it's up for everyone. We're answering that. All right, so here we have the results. Pretty much tied, 47% men, 50% women. I saw some other as well. So again, thank you for everyone. As we said, we wanted men to participate, but it's great that we have women as well to come and bring this knowledge into your life and help the men that you know live healthier lives as well. And then here's our other poll question. What is your primary reason for joining today? Maybe we should have Jeopardy music playing during this. All right, so 53% said I'm looking to find ways to stay healthy. 41% I would like to encourage someone I know to improve their health. And we have a good 15% that said other. So that's what we're here for. Either for ways that we can live healthy, or we have a loved one that we want to help them live healthier as well. Okay, so before I pass it on to Dr. Torien Easterling, we'll just give a quick bio. Dr. Eastland serves as a Deputy Commissioner of the Center for Health Equity and Community Wellness at the New York City Department of Health and Mental Hygiene. The Center for Health Equity and Community Wellness seeks to eliminate health inequities for those who are most marginalized in New York City and to reduce overall premature mortality from the leading causes of preventable death. Prior to the Health Department, Dr. Eastland served as an Assistant Professor for the Department of Family Medicine at Rutgers, New Jersey Medical School, where he oversaw the training of medical students in family and community medicine. Dr. Eastland, we're really, really happy to have you today. Thank you for joining, and now I'll pass it on to you.
Great, can you hear me?
Yes, we can hear you.
Awesome, okay. Thank you so much, Daniel, and thank you to all for joining. I guess we'll cue the slides shortly.
Yeah, so the slides are up.
Okay.
Sorry, if you see the slides, there we go.
All right, so again, I want to thank everyone for joining us today. As already mentioned, Daniel mentioned, my name is Dr. Torien Easterling, and happy to join you all as we focus on men's health. As we think about sort of our own personal responsibility, certainly during this time, we also want to think about the responsibility that we have to not only take care of ourselves, but our loved ones as well, while also thinking about the various environments, whether they are work or in our neighborhoods or in our places of worship, and ensuring that our health in the ways in which we are supporting our health is also supported by the environments that we live in. And so often we say that you know, the places we live in as well, and the places that we also exist in can also support and do support our health. And so we have to make sure that we lead with the conversation that, yes, part of it is our own responsibility, but also ensuring that our neighborhoods support our health as well. And so ways in which we safeguard our health, living a healthy lifestyle certainly can help prevent chronic disease at long-term illnesses. Thinking about the ways in which you pour into yourself, so feeling good about yourself, taking care of your health are also important ways to support self-esteem and self-image, as well as maintaining a healthy lifestyle, which is good for you, your family, and your loved ones. Next slide. But we know that this isn't an easy process. It is certainly, there are challenges, there are struggles, there are barriers, and I, as a practicing physician, having practiced for 7 years and still volunteering when I can for free clinics, I know that often the narrative is that men do not like to go to see their doctor. It is much deeper than that. And so I always like to shift that narrative and identify what those challenges are. And this slide is really identifying some of the challenges, but we know that it is a long list, right? And so, men can struggle to maintain good health for various reasons. There are social factors that are personal, but then there have been social factors, external factors that have led to, why Black and brown men often do not show up, not feeling welcome, not feeling valued, particularly in spaces of care. And that has been rooted in systematic and structural racism, and is not limited to Black and brown men as well. And so we understand that, Black and brown communities often feel neglected when they go to their healthcare systems, or they feel that there is a lack of access, or because they do not have health insurance. And so this is not only a barrier for Black and brown men, but we also know that this can be anxiety producing as well. And so we have to do work, and part of our work is really trying to undo and disrupt those type of systematic issues to ensure that everyone can achieve their best health. And there's no one size fits all approach here. We have to do more around our healthcare delivery system. We have to ensure that there are resources in our community. We have to make sure that discrimination and bias does not show up in how resources are allocated. And we always have to lead with dignity and respect. And so this is certainly the work that we have to do, both as the work of New York City Department of Health and Mental Hygiene, but I think that this is certainly the work that we can all do. And as we are advocating for our loved ones, this is also certainly something that we want to make sure that we continue to push and support for the best care for our loved ones as well. And so aside from cancer, men have a much higher premature death rate for most causes than women. So it is certainly never too early to talk about, health issues, health challenges. And so, we really want to encourage that this conversation around what are the preventive steps that I need to take, that men in your family, that your loved ones, that men who are joining us today, what can you do to make sure that you're taking care of yourself? And so, certainly we are sharing these numbers here, but it doesn't tell the whole story, right? And I talked a bit about some of the structural issues. And so in this context, we also understand that there are not only challenges in the healthcare delivery system, but there are challenges in what resources are available even in your neighborhood. And so certainly the ability to have access to parks nearby, to have healthy fresh fruits and vegetables in your neighborhood are all very important. And so, we want to make sure that that point is not missed as well. And so it's certainly important, that we have to find ways to talk about What are the diseases that are most at risk? For example, colon cancer or prostate cancer. When are the regular screenings and what are the appropriate ages? And talking, and not only knowing the appropriate ages, the reason why it's so important is because we want to be able to know if my grandfather or an uncle in the family previously had any issues, that mom have any issues, because then that would also inform if I need to get screened at an earlier age. And so it may be there may be discomfort in talking about diseases of family history, but this can certainly prevent avoidable complications in the future. And so having those conversations is important, and also understanding what are the points in which I need to be seeking care, and that's also important to talk about. And this is needless to say how important this is, especially at this moment as we are talking about generational changes. We are in a moment in time where I think we're seeing how societal factors are playing into the family structure as well, and making sure that we have a positive outlook on health, we're getting the right resources, can also impact generations to come. And so certainly want to make sure that we're having conversations, with our elders, maybe having conversations with the younger folks in your family, but also thinking about what are the resources in your community. And so this is an important time. And so with that, we'll move on to discovering wellness. And so here, really talking about not only we talked a bit about some of the individual behaviors and how they can impact and play on someone's health. And historically, we have looked at individual behaviors as reasons for differences. But we know, as I was saying, that some of these differences in these outcomes are actually rooted in some of the social and structural inequities. And we have been saying that they are avoidable, unfair, and unjust. And they can certainly have an impact on someone's mental and physical health. And so as important as it is that we are taking care of our personal lives, it is also important that we are also ensuring that there are resources in our community. And so, where you live also impacts your health. And so we continue to do work to make sure that folks have those access to the resources and really can connect to them. And so that's always important. Next slide. And so we show this map really to drive the point home that your environments matter. Long-standing rising income inequalities, history of racial residential segregation has led to startling health inequities. And certainly, as we see COVID-19 playing out in New York City, certainly the inequities have been long-standing as well. And as a result of these long-standing inequities, we're seeing higher disproportionate rates of COVID-19 cases and deaths in many of the neighborhoods that you see that are here for premature mortality and poverty. We're talking about North and Central Brooklyn, South Bronx, Northern Manhattan, East Harlem and Central Harlem, Southeast Queens. These are the same neighborhoods that we've seen higher rates of premature mortality. And now we're seeing higher rates of COVID-19 cases. And so this map could be poverty, jail incarceration rate. It could also look like, when we think about high school graduation, these maps look the same. And so it tells the tale of two cities that we live in and those who have and have not. And we have to do more to address these systematic inequities and really disrupt how racism has played out in this city. And so next slide. So important that we are taking personal steps. And so again, it's a pleasure that I'm here talking about the importance of men's health, the things that we have to do, and certainly not just, here's what you need to do, but a much broader conversation about how we need to really support steps to maintain and improve everyone's health. And I think that this is an important conversation, not only to center men, but also to center how we think about health and really broaden this conversation. So it's been a pleasure to join you today, and I'll turn it back over to Daniel.
Yes, Dr. Eastland. So we still have a little more to go, but we have a poll right now to lead off this conversation about action plans. We want to hear from the audience in terms of what they're doing for their action plan. So we're going to have 3 different polls come up. And then Dr. Eastland, I would like to just have a slight discussion with you in terms of those responses. So we'll pull up the first question. And the question is, do you have a primary care provider? Yes or no? All right, and we should be getting the results any second now. All right, so it looks like 86% of respondents have a primary care provider, while 14% do not. So I guess, Dr. Eastland, what are your thoughts on those numbers? Is it good? Should we get it higher? And then also, maybe if you could just speak a little bit about the importance of having a primary care provider.
Yeah, no, this is an important poll to show how we know that, oftentimes, we know that people do not have a primary care provider, or men do not have primary care providers. So this is an important point to show that folks are taking, they're taking a focus on their health. And I think we can certainly get it higher. We certainly want to make sure that 100% have a primary care provider, that they have health insurance. And so I think that this is one of those questions where we should all have a primary care provider.
Okay, great. All right, so let's go to the next question. So in the past 7 days, how stressed have you felt due to COVID-19? So you have extremely, very moderately, slightly, not at all. So we'll let everyone answer that. And we should be getting the answer any second now. Okay, so we have the most 42% have moderately felt some form of stress in COVID due to COVID in the past 7 days. Then we have about 22% that said very, 7% extremely, 22% slightly. So Dr. Eastland, as you can see, the overwhelming majority of our respondents, which is understandable, I'm there with them, have felt stress at some point, specifically related to COVID-19. So I was wondering if you could maybe speak a little bit to that, to maybe what are the contributing factors to this stress, and any suggestions of coping techniques.
Yeah, certainly this is been coming up a lot about what we can do during this time to really take care of ourselves. Certainly when there's a lot of information coming out about COVID-19, how do I take care of myself? But then a lot of that information could be conflicting, or some of it is missing. Where are the tests really free? Do I have to do, have a copay related to COVID-19 testing? What treatments are available? Should I get an antibiotic test? So there's just a lot of questions. And so this is certainly anxiety producing. And I'm just one person, and certainly taking note that 29% of your respondents are saying slightly or not at all. And so, we'll be really interested to hear from those who reported not feeling slightly stressed or feeling not stressed at all, to hear what's been working. And I think that's that's important. Right now is the time that we really have to lean on one another, learn what's helping. Folks are using yoga, meditation, and prayer, all different types of things to really, try to prevent stress and anxiety during this time. And the more that we learn from one another, I think the more helpful it will be.
Great. So as Dr. Eastland said, if you want to share your own coping techniques, please type it in the chat and I could share some of those. What's been helping you, and I could definitely share with the group. And while you do that, we'll also bring up the last poll question. Okay, so in the past 7 days, how often have you been able to practice self-care? So that means did something you enjoy doing, gone for a walk, exercise. So you could say every day, some days, not at all. So we'll let everyone answer that. And also in the chat, please share what you're doing throughout this time. And as we're answering this, I'm seeing people saying they go for a walk. Prayer is what gets me through my stress. People are doing a lot of home workouts, cooking their favorite meals, consuming Black art, gardening. So a lot of great suggestions there. So here we go. We have the results. So as you can see, Dr. Eastland, 60% have been able to do so some days, 30% every day, and 10% not at all. So I guess maybe my question for this is, especially maybe for those that have found some difficulty in starting something to help them get through the stress. Do you have any suggestions of what they could do maybe even today or in the following week to figure out maybe what's good for them and how they start that habit?
Yeah, and certainly we are still in a moment where precaution has to be, the important and primary step, even while we're still looking for cases and transmission to really be suppressed in our community. So, even as we are encouraging physical activity and really encouraging, getting out and doing walks, we still have to make sure that folks understand that we're not out of the woods yet. And so we have to, one, make sure that folks are sharing the right information. So as much as you can, yourself, your loved ones know where they can get tested, because having information is going to be helpful. Two, I think also figuring out what you can do in your own home to make sure that you are, keep moving, doing activities, whether it's exercise, stretches, yoga, Zumba, if the space allows, but also, finding time to connect with family, whether it's by Zoom or WebEx or Google Chat, because certainly isolation can also, exacerbate, anxiety and stress. And so, I hope, these are some of the things that I know people have been finding time. And if you do choose to go out, you're wearing your face coverings, you're making sure that you're staying 6 feet apart while you're walking or you're doing some light exercise at a nearby park.
Great, thank you so much for that. All right, so I want to pass it on to you, Dr. Easterling. We're going to move on now to the game plan. So specific recommendations and techniques for us keeping a healthy, active lifestyle.
Great. And so, certainly this game plan sort of outlines for everyone, what are the things that we really have to do to make sure that we continue to maintain our own health. And so there are a few things that we want to make sure that we list out, and you've seen them, getting regular checkups. And so starting with getting regular checkups is important for us. As I mentioned earlier, that everyone should have a healthcare provider. And, certainly if anyone does not, I know that the poll wasn't 100%, certainly reach out, follow up with us so we can help to make sure that you are connecting with a healthcare provider, about the benefits and risks of preventive screening tests, and certainly screening early can help make sure that we identify early before any symptoms show up. And also, asking some of the right questions, right? We will really want to know if there's a family history of cancer or of other concerns and issues. And if that is the case, what are the right steps for you to take, and talking to your healthcare provider can help inform that conversation as well. And so to that point, if you do not have a healthcare provider, certainly, we can follow up. If you need help with finding health insurance, we can certainly help. And that end, it's free, it's in person for someone to sign up for low or no cost health insurance. Medicaid is also available through our health department enrollment counselors. You can text Covered NYC, call 301. So there are lots of ways that we want to make sure that folks feel connected. And also, so the next step in the game plan is also about quitting smoking. So if you smoke, you should consider or reconsider quitting. And I know sometimes it takes 3 or more times for someone to really quit smoking. And the challenges and what we know, smoking increases the risk of cancer, not only lung cancer, but also colon cancer, heart disease, and stroke. We have a program, the Employee Smoking Cessation Assistance Program, which provides free quit smoking counseling and resources for you and your household members. You can call and get more information about the ESCAPE program, medications that are available, and it is confidential as well. And then as it relates to mental health, we know that for men and mental health, talking about mental health disorders, talking about the challenges may not be easy, right? Certainly not easy talking about various disease or colon cancer, but talking about mental disorders is not easy. So 1 in 5 New Yorkers have symptoms of a mental health disorder. We certainly see how COVID-19 has been playing an impact on our stress and anxiety, and certainly want to make sure that folks feel supported. And there are many folks who are walking around with anxiety, not only to COVID-19, but to everyday life stressors. And so certainly seeking help is important. We can expect that the prevalence of depression and other mental health disorders will continue to increase. And certainly if someone has been directly impacted by COVID-19 and has recently lost a loved one, that can also exacerbate feelings of depression and isolation. And so seeking support is also needed as well. And so what does that look like? I mean, it is taking a huge step and being courageous enough to say that you do need help. It's different from insulin or hypertension medication, but seeking support around mental health is courageous and bold, and to really say that I'm not sure what's happening, why I'm not the same, I do not feel like myself. And so if you're looking for support, you want to contact the New York City Employee Assistance Program. We also have NYC Well, which is available for supporting counselors that are available 24 hours, 7 days a week, and around the clock for the entire year. And so it really allows for someone to be courageous, to have a conversation with, either a friend or a loved one, or a counselor, and to really have that conversation and let them know what you're experiencing, what are the feelings of depression or anxiety that you're feeling, but also understand that when you're having that conversation, that you're not giving up your power, you're not giving up your sense of ability to take care of yourself. You're really saying that it is my choice and it is in my power to really make a difference for myself and to make sure that I can lean on someone else. So really seeking support is something that we really want to push. So along the lines of our game plan, certainly eating to thrive, eating to live is important. So men are more likely to exceed the recommendation for sodium intake than women. This increases their risk of high blood pressure, heart disease, and stroke. So certainly good nutrition is an important part of leading a healthy lifestyle. You want to combine it with physical activity, your diet, certainly to maintain a healthy weight and reduce your risk of chronic disease like heart disease and cancer. And certainly eating to live and eating to thrive also promotes your overall health. And so this is also certainly an important step and making sure that you have access not only to this of nutritious food, but also access in your community. So we want to continue to stay active even while social distancing. And I mentioned, certainly wearing the face coverings, making sure that you continue to stay 6 feet apart from others. And so while you are out, it is important that if you go out for a walk, you want to at least get 150 minutes every week if you can, knowing that places are closed, but definitely there's nice weather out, and if the time is available, to go out and really just get your walk in. And so if you want to time it well, you'll do about 30 minutes a day for 5 days a week. This maximizes the benefits for exercise and physical activity, and also will continue to encourage movement and ensuring that even while we are social distancing, that we are taking care of ourselves as well. So now it is time to discuss.
Great. So great, Dr. Easterling. So I'm going to in a little bit pose a couple of questions to you from the audience, but before that, we were saying we definitely want to get feedback from our audience. So if you can in the chat right now, write 3 things WorkWell NYC can offer to you during the COVID-19 pandemic to help you improve your health. So I saw in the chat a lot of people talking about challenges, what they're doing, but maybe what other needs there are. So if you could do that now, write that in the chat, 3 different things. And while you do that, we're also going to bring up a poll as a way of also collecting that information. So we're seeing mental health webinars. So more information, people are saying about smoking cessation, a grid chart of types of foods with benefits, risks and recommendations. I've seen exercises classes online. We have a bunch of those. So we'll share that resource. We have a bunch of virtual fitness classes for city employees. An open chat where men can express struggles and thoughts. We're going to be having that actually tomorrow. You'll see that a roundtable discussion. We're going to have several male city employees come together and talk about the challenges that men face seeking mental health care, and it'll be an opportunity for participants to pose their questions as well. Great, so we're getting a lot of, so we're going to record these and we'll continue to report these. So if we want to know, if you could, we'll pull up the poll, the last poll. Okay, what programs or workshops are you likely to participate in? So if you could respond to that. And this will give us a good idea of further programming we could offer city employees. Okay, and we should be getting the answer to that right now. All right, so we got a whole bunch of, so around 60% who do cooking classes, 30% parenthood, fatherhood, co-parenting programming, softball, basketball, football league. So I know a lot of agencies, they do have their own, well, not right now, but they have in the past had softball leagues or basketball leagues. So it's definitely when we returning back to the office, you can check up on that. I see push-up challenges, so we're definitely seeing how we can incorporate more challenges. So at 75%, a good amount on finance workshops. So yes, we will be working to bring, they have some of this programming and future programming as well. So thank you for all that feedback. So Dr. Easterling, I would just like to go into the Q&A component right now. We've had a lot of questions. So I've seen kind of two questions, a common theme. So I'll pose those two for you. So the first, I saw a lot of questions in terms of, it seems like especially a woman, or it doesn't have to be a woman, it could be a son, a good friend. How do they talk to the men in their lives to help them promote healthier living? So someone said, like, how do I get my husband to understand that his high cholesterol is serious and needs to take his prescribed medicine? Another was, how do I encourage male loved ones to be more on top of getting general checkups? And then also, like, how do I talk about mental health concerns without upsetting them? So it seems like if you have some tips of how someone could sit down with a male loved one and if they know that maybe they could be taking some steps to promote their health, how can that conversation go that doesn't lead to the other person shutting down or being offended or not taking in what they're saying?
Sure. Yeah, I think that this has to be a multi-pronged strategy. And I think even the loved one would have to know, sort of, who do they listen to most? I think if that loved one is a husband, if that loved one is a father, then oftentimes, it may not be the spouse, and it may be their peer, or it may be, someone else who is in the family that, that they often just listen to when advice are given. And so I would often, certainly with my patients, I would often, rely on some of the people who I knew that my patients listened to. And if that wasn't their spouse, if I knew that, I knew their friend, I would often say, this is a time for them to think about their children, or to think about, who are the people that matter most, so that they can make sure that they're there for them. And I would also encourage even my barber to, as he's, cutting hair, to really, encourage men who are coming into the chair. Just remind them, hey, did you get your hair cut? And these are just some of the ways in which, we could have impromptu, informal conversations about the importance of health. And one other thing that I thought was that's I think is really helpful to also think about is really thinking about how you can make it a joint activity, and encouraging someone, if you're going to get tested for COVID-19, or if that person has to think about a colonoscopy, is to think about who else can go with them, and to make sure that they're having the conversation. And I think sometimes we do need a support system to make sure that folks feel like they're not going in by themselves, or someone's going to be looking out for them. So that's just one key call to action that could be helpful.
Great. Yeah. And just as a follow-up, we actually are putting together a resource. So Father's Day is this weekend. And we'll be sending out an email to everyone. It's just 5 simple activities you can do to celebrate Father's Day with men in your life that you love, that also bring in health and wellness, and how you could start a conversation about health, and what, as you said, activities that you could participate in. A lot of times it's helpful to figure out like what you could do with that person that is a healthy activity.
Mm-hmm. Right.
Thank you. And then the second question, we were getting a lot of questions around this, and you sort of touched on this, is in the current environment, you mentioned the health disparities that Black and brown men experience, and in the current situation right now, displays of, systematic racism, how that impacts the stress can impact the mental health of Black and brown men. And kind of the question is like, how do we address that, and how, people that are not Black and brown men, like what they could do, offer support, what they could do to, maybe remove some of the stigma around particularly Black and brown men seeking mental health care.
Yeah, no, it's an important conversation, and I think a conversation now that we have to have in all of the spaces, not only within the health system, also thinking about education, criminal legal system. Really, the first part is really understanding what are the policies and the rules that have been put in place that support and perpetuate oppression and discrimination. I mean, as much as we, or as an individual, is really pushing for these changes, we understand that there are policies in place that are really supporting and perpetuating discrimination. And so we can look back as early as the 1930s, and we can look at redlining, or you can even look even more closely, sort of the, war on drugs, and then even coming into the mass incarceration state that we're in. And so really looking at what are those policies that are in place. And then sort of thinking about what are the individual actions that we can do. We can also be sure about how we're checking our own bias. And there are a number of tools that we all can use to even measure our bias. How does it show up? How are we thinking about our work? Our programmatic work, how are resources being allocated, and really thinking about what tools can we use to make sure, are our programs being allocated to really address the most vulnerable, to make sure that the vulnerable are included in our programs and our resources to really bring it together. And certainly these are steps that, healthcare systems will need to take, the Department of Health and Mental Hygiene is taking. And, and I think this is the rollout. So then individuals who are coming in for care do not feel like they have to be burdened with doing this on their own. But certainly loved ones, as you're going into the health system, really having a conversation with the provider and really making sure that they are taking into account some of the cultural nuances, the differences that show up and how they could impact one's health. And so if we're not having conversations about the types of foods that the family normally eats, or the type of religious practices that are there, then how are we really taking that into account into the person's health? And so that's the way in which culture shows up if we want to really have a frank conversation about health, right? It's not looking at the person as one size fits all.
Great. Yeah, I know we could talk about this for the next hour, but it is a really important topic, and I'm glad that we could add a little bit to that conversation. So before we move on to the last part, which I'll take over, Dr. Eastland, did you have any other last things that you would like to say or final pointers?
No, I thank you again for having me, and it's been a pleasure, and I do hope that the information was received well as we're thinking about taking care of ourselves and promoting the health of others. So thank you for allowing me to be here.
Great, and thank you for being part of this. We really do appreciate your time, and this was a great conversation.
Right.
Good. Thank you. So before we sign off, I just wanted to wrap up with some things. So just the last kind of our takeaways from this is that, we do want to think about, what do you need to maintain your health? We talked a lot about today, different health activities, available resources for city employees to maintain and promote their health. So think about a little bit about what you took from today. And if you have any questions about that, feel free to put it in the chat box and we could address that later. We talked a lot about how talking to your loved ones and supporting each other to be healthier is really important. A lot of people, we saw with the questions, a lot of people are asking, like, how do I, help men in my life that I love to live healthier? And it's just about having open conversations and non-judgmental conversations, and being there to show that you support them and thinking of ways you could participate in their health. And lastly, we definitely want you to check out all the great resources from WorkWell NYC and the city, and to let us know what you need. So you did that in the chat box before, as well as a poll, but continue to provide that feedback in the chats. And we pretty much went over all these resources. I won't go into them that much. We'll receive in an email all these different resources with a link to access that. So look for that email. We'll be sending at the end of the week. If you join this webinar today and feel inspired to continue working on your health or helping your colleagues live healthier lives, there are multiple ways to do that. So we have the Champions program, the Ambassadors program, and the Partners program. The Champions, they're worksite health influencers. They're on the ground at their agencies, helping and letting their other colleagues know about webinars like this, telling them, hey, join, let's be part of this, letting them know about the different resources. It's just about you being a champion to allow others to know what's going on and what they could do to live healthier. Ambassadors are similar. They're citywide leaders who play a critical role in extending WorkWell NYC's reach by helping promoting and planning wellness programs at their site. So you have the power to bring wellness programming to your agency. So if you're interested, you can sign up to be an ambassador. And then we have the partners program, and that's at the agency level. So city agencies will become a partner with WorkWell NYC, and we work with them to bring programming to their specific agency for their employees. So if you're interested in any of those, email us at workwell@olor.nyc.gov or send in the chat box as well. At the end of this week, as I said, you'll be getting an email. It will have a survey link. So please do that survey to tell us how this presentation was and also the other programming for this week. As I mentioned, we'll also have a resource sheet and also just information on how to enroll in all these WorkWell NYC activities. And then lastly, this is just the beginning of Men's Health Week. We still have 3 days. Tomorrow, I mentioned we have our Blue Table Talk, a men's mental health roundtable discussion. So that will be a group of city employees, male employees coming together to talk about why men are, the barriers to seeking mental health care and how we can support men in our lives to promote their mental health. Thursday, we're doing a live Power Up with Protein Q&A. Come and ask all your different questions about protein, how to incorporate in your diet. We have a lot of questions I sorted as well that we can get to, but questions about supplements. So you'll learn all about that in the Power Up with Protein Live Q&A. And then finally, Friday is our Wear Blue Day photo challenge. It's a challenge for you to wear blue, post on social media, use your hashtag, tag WorkWell. You'll see the information there of how to participate in that. And then also we're posting in the chat right now a link to this one-pager where you can register for all the programs and participate. So that's it. Thank you so much, everyone, for participating today. It really was a great conversation. Again, Dr. Eastland, thank you so much for taking the time. You've had a wealth of knowledge on how we can promote our men's lives, our health, and help the men in our lives live healthier as well. Thank you, and take care, everyone.